Our next speaker is Xinzeng Wang. He's a master's, holds a master's degree. He's a graduate student, a doctoral student in the biomedical engineering program here at UT Southwestern. He's supervised by Anant Maduranthakam, and the title of his talk is MR Neurography of Brachial Plexus with Robust Fat and Blood Suppression at 3T.
Okay, thanks for introduction. Today I'm going to talk about MR Neurography of Brachial Plexus. Okay, brachial plexus is a set of nerves coming from the spinal cord and running into the arms. It may be involved in several pathologies. In T2-weighted image, we usually suppress the fat to increase the contractility of the nerves. And the blood vessels also preferred to be suppressed as it often confounds the visualization of the nerve. But when we move to a 3T, the 3D imaging of the brachial plexus has the advantage of high SNR, complete coverage, thinner slice, and better characterization, but it still have a lot of challenges for robust fat and blood suppression due to increased B1 and B0 homogeneity. So our purpose is to develop a volumetric MR neurography technique with robust fat and blood suppression in clinical feasible scan times. Currently, there are several methods proposed for the fat suppression, but they all have their limitations. For the spare, it is sensitive to the B0 inhomogeneity, still suffers from low SNR. For chemical shift acquisition like Dixon Method, it can provide uniform fat suppression with higher SNR, but the scan time is very long. If we can reduce the scan time, we can make this method more competitive. So first, let's have a look at how the Dixon method works. After the excitation pulse, both the water and the fat spin will tip down to the transverse plane. If we wait about 1.1 millisecond at 3 Tesla, they will have about 180-degree phase difference. Here we can acquire the out-phase image. And wait about another 1.1 millisecond, the phase difference will be 0. We can acquire the in-phase image. If we add these two images together, we can generate the water-only image. And the current implementation on the 3T scanner is called multi-acquisition. It means it acquires the in-phase and out-phase echo in the separate repetitions. So it will simply increase the total scan time by a factor of 2. So we implement multi-echo abduction for the 3D TSE. Here we acquired the in-phase and out-phase echo in the same repetition. So it will reduce the scan time. But for the high-resolution imaging, we may not have enough time to acquire the full echo to maintain the optimized in-phase and out-phase interval. So here we will acquire the partial echo. The advantage of this strategy is that it can reduce the echo spacing. But if we directly use the partial K-space to do the zero filling reconstruction, it will have some reading artifacts. So we are going to use the Homodyne Reconstruction to remove these kind of artifacts. This is a scheme of the traditional Homodyne Reconstruction. Here you can see we have a phantom. This is the fat. This is the water. Finally, this reconstruction algorithm can generate an image with high resolution. But this image just amplified the image, no phase information. If we just use this image to do the water-fat separation, it basically failed. So we will reuse the phase estimate from the low-resolution image, put it back to the high-resolution image, and then do the water-fat separation. We can successfully separate the water and the fat. We evaluate our sequence and the reconstruction algorithm for using a phantom study. Here you can see we can achieve similar water and fat separation and get a similar image quality, but we can reduce the scan time by half. So far, I talked about the fat suppression, but for the blood suppression, we are going to use the variable flip angle TSE. This sequence, if we use low flip angle refocusing pulse, we will make it sensitive to the motion. So this is a phantom study, this is a simulation. From here, you can see if we reduce the minimum flip angle, this The moving water in the two tubes will be suppressed. Here, we will use 20 degree as the minimum flip angle in our following study. So we evaluate this sequence for 5 volunteers and 5 patients. At the first 3, we tested the spare, but this one has resulted in a large area with incomplete fat suppression. So to save the time, in the following patient study, we just test the abduction and the stir. The stir is the current standard of care sequence for the brachial plexus imaging. We try to match the same FOV and get the 0.7 millimeter isotropic resolution, and we match the same scan time. This is one volunteer data. From here, you can see the stir sequence will result in an image with a small area with incomplete fat suppression, and the SNR is very low. For the spare, you can see a large area with incomplete fat suppression. For the abduction image, you can see the fat is completely suppressed, and the SNR is also very high. This is a 3D view of this another volunteer, and here you can see the scan time is 6 minutes. If we use the product multi-acquisition strategy, it requires 20 minutes. So from here, you can see you can evaluate the image along any direction as you want. This is one patient data. Besides the sensitivity to the B0 homogeneity, it is also sensitive to the B1. We have a poster talk about detail about that. The sensitivity to the B1 will result in the shading artifact. But if we look carefully at the lesion area, from here you can see the lesion is too close to the lung. Here, the part of the lesion is oversuppressed. But using abduction, you can see the fat is uniformly suppressed, no significant shading artifact. This is another patient. From here, you can see we can achieve uniform fat suppression across the whole volume. Yeah. And Dr. Chopra graded the image quality on 3-point scale for the fat suppression, blood suppression, and nerve visualization. From here, you can see for the fat and the nerve visualization, we can get significantly improvement. But for the blood suppression, it is better, but not statistically significant. We also measured the apparent SNR on the dorsal nerve root ganglion and the C6 nerve. The abduction method improved the apparent SNR compared to the stir. So in conclusion, multi-echo TIC abduction, it can reduce the total scan time by half, and it can achieve uniform fat suppression, better nerve visualization with high SNR. And then using a low flip angle and large echo spacing, we can make this sequence more sensitive to motion. Then we can get better blood suppression. In the image, maybe you can find some small vessels are not completely suppressed. The blood suppression method will be tested in the future for the suppression of the small vessels. That's all. Thank you.
Are there any questions? Neil.
Dr. Chhabra? Was Dr. Chhabra blinded to the sequence he was looking at?
I think so.
You hope so.
Because for the stir, when we evaluate the image, you always can see there is area with incomplete fat suppression. But for using our method, it's obvious no fat there. So if you understand that, maybe you already have some background.
Maybe you should have a second reader that Dr. Rofsky was pointing out for the previous presentation. And you want to have multiple readers to make sure this is consistent between readers in their grading.
Okay, yes, thank you.
No other questions? Thank you again.